Since I've been in private practice, I've been emphasizing dementia care. My fellowship was in behavioral neurology, which mostly is the study of dementia. So I did some research for a couple of years in the subject matter of dementia and have been interested in the care of those patients since then. Dementia is a condition in which people have memory problems and other cognitive problems, other thinking problems. It's usually in the elderly, and it can be quite difficult for family members to deal with. And so I can help them understand some of the medications that are available and some ways of dealing with some of the issues that come up. There's a myriad of problems that come up with dementia. It's not just the memory issues, it's also some of their actions and behaviors, and there are some ramifications on the family members. There's genetic questions, legal questions, and I can begin to help people understand how to at least approach some of those issues. Memory problems are often seen as people get older, and usually it's in the form of minor forgetfulness, like they forget why they went into a room, but later on they remember, or they can't remember the name of a certain item or a certain person, but later on it comes back. To some degree, we see that in people as they age normally. But if people start to have problems functioning in the normal life, like they have difficulty making the coffee, or they forget to pay bills, or they have difficulty at work, that's a different level of severity. At that point, we become concerned about a possibility of dementia existing in that patient. So further evaluation is warranted. What we really need in neurology and neurosciences is something that reverses dementia. There are many causes of dementia, by the way, but Alzheimer's is the most common cause. And we don't have that yet, nothing that clearly halts and reverses the progression of the condition. We have several medications which sometimes help some of the symptoms, and we have other medications which can help some of the behaviors. We also have some techniques, things that family members can do or learn how to do to help life with a patient with dementia. So there are some treatment options. It's not a curable condition, but it is a treatable condition. There are things that we can try. Prevention of dementia is obviously a hot topic, and people are looking at various medications that could prevent it. But the strongest risk factor is age, and we can't, of course, do anything about that. Another risk factor is head injuries, so avoiding head injuries. The best thing you can do for memory problems is to be medically healthy. So exercise, take care of your other medical conditions. If you have diabetes, treat your diabetes. If you have high blood pressure, treat your high blood pressure. Those are the kind of things that may slow the development of memory problems. It's interesting, there was a study done at the University of Washington, or at least in Seattle, several years ago. Very interesting study, which has been replicated. It showed that if patients, elderly patients, walk 20 minutes 3 times a week, it can slow their memory loss by up to 40%. Totally unexpected. But one of the best things we can do is to be as physically fit as we can be. If we are physically fit, we control our medical conditions, we exercise, we eat right, we try to do things that are intellectually stimulating or challenging. That may be some of the best things we can do to slow memory loss.